Hello and welcome to this very special Facebook Live session that we have for you this new year. Happy New Year to all our viewers. Thank you for joining in such large numbers for our previous sessions. And I'm sure the topic of discussion today will be of great interest to all of you as we discuss with another specialist on of dieting, on weight gain, on effective weight loss strategies, and what you can do about it in this new year, because we are sure a lot of you would have taken new year resolutions to look at your dietary habits and to look at some weight loss strategies. So welcome to this live session and welcome to my two experts, Dr. Arun Prasad, Senior Consultant, Bariatric Surgery, General Surgery and Gastric Surgery at Indraprastha Apollo Hospitals. Dr. Prasad, welcome to the Facebook Live session and Happy New Year.
Hi, thank you very much. Happy New Year. And congratulations for taking this great initiative on this program that would be good for the public information.
Thank you. Thank you. And I'm also delighted to be joined by Dr. Deeba Siddiqui, who's a pediatric nutritionist at Indraprastha Apollo Hospitals. Dr. Deeba, thank you for joining the session.
Thank you so much for giving me the chance.
So let's dive straight in because there's a lot of subjects to discuss. Dr. Prasad, I'll begin with the most important question. A lot of us would have rightly been enjoying ourselves for the past couple of weeks, maybe more, and then hits the new year and new year resolution plans. And I'm sure a lot of us are looking at effective diet strategies and also about losing weight for most of us. And for some of us, how do we gain weight? But before we get into all of that, let me ask you a broader question, which is, why is maintaining a healthy weight and such an important health goal?
So once the weight goes beyond what we say as the ideal weight for a person or an ideal BMI for a person, that leads to a lot of stress on the body. And this can manifest as various problems like diabetes, blood pressure, joint pain, breathing difficulty, sleep apnea, depression, and also an increased incidence of cancer, reduction of the lifespan, and of course, we all know that obesity is related to issues of mobility and activity. So people are not able to be active in their lives and lead a good quality of life, which is what we would like everyone to do.
Right. So there's a whole host of health-related issues that emerge out of an unhealthy weight. So how do you characterize healthy weight? You spoke about BMI, but how should one look at their weight and monitor it?
See, BMI is the simplest way to look at your weight and how balanced it is. And these days, you just need to go on the net, Google BMI calculator, enter your height, enter your weight, and you'll get the BMI. And usually for Indians, we say anything above 22.5, one should get alarmed. Beyond 25, it starts to get serious. After about 27, 28 BMI, you start getting various medical problems. Once the BMI crosses 30, then things start moving into an irreversible phase, whereby it becomes very difficult to lose weight and the medical problems start increasing. And that's where people start seeking medical help and even surgical help like bariatric surgery.
Right. So you've outlined for us BMI as an effective tool that one can look at. One would encourage people to go out and look at this tool and use it as an effective indicator. Dr. Prasad, I know you lead a very active lifestyle. Anybody who knows Dr. Prasad sees him very active, out and about. So what are some of the effective strategies, both as a professional and as a person, that you have found to be effective in managing your weight?
Right. So most crucial part of managing the weight is diet. It's diet. 80% is diet, 20% is the rest. So when we talk about diet, you need a balanced diet. You need a diet that can be sustained. So there's no point having a diet that you can only take for a month and after a month you give up. So diet has to be something, a style. It's a lifestyle which you can maintain for a long period. Basics of diet: have everything, keep it balanced. In Indian scenario, there is always a deficiency of protein intake and there is an excess of carbohydrate intake. So these 2 points have to be considered very carefully, that one has to take more of protein, both people who are veg and non-veg, and try or reduce your carbohydrate. When it comes to fat, try and take more polyunsaturated fat. So this kind of a balance is important. Once this balance is there, then comes the role of physical activity and exercise, which is to keep you fit. Because if you don't exercise and don't keep yourself fit, then the protein that you are going to take is going to all get converted to glucose and get metabolized. So you need to have adequate exercise, both in the form of aerobic and some kind of a resistance or weight training. This can be minimum based on age of the person, based on their lifestyle, but some amount always has to be there.
Right.
Following this, when we talk about lifestyle, sleep pattern is very important. Adequate sleep, early to bed, early to rise, what our grandparents taught us is still valid for us because we have the same genes, and this is going to be valid for a long time. Even if you have lights which are there which make midnight feel like day, but still this early to bed, early to rise pattern has to be there. The diet, again, going back to that, when we talk about lifestyle, it has to be at regular intervals. So don't confuse the body by having lunch at 12 one day, lunch at 3 the second day, missing out on the lunch the third day. So that kind of confusion again can create imbalance and lead to problems.
Right. So moderation and regulation are two important mantras there. Dr. Deeba, I'd just like to bring you in to what Dr. Prasad just mentioned. Since diet is 80% of weight gain or weight maintenance strategies, and he also mentioned about the fact that Indian diets are quite rich, especially in carbohydrates and fats, and the need to increase protein. What are some of the foods that one should include in one's diet, both for vegetarians and non-vegetarians? And more importantly, what are some of the common pitfalls on the Indian dietary plate that one should look at critically and reduce?
In Indian diet, most of the Indian diet contains carbohydrate, but we should not exclude carbohydrate. Carbohydrate should be included, but complex carbohydrate and low glycemic carbohydrates should be focused. And in most of the Indian diet, fruits are almost. If I am taking the dietary recall of the patient, in most of the patient they are not taking the fruits on regular basis. We have to include 2 to 3 servings of the fruit depending on the disease condition. We have to include daily, and salads and vegetables are the most essential in the salad form or in vegetable form. 5 to 6 servings of the vegetables should be there in the diet. And beside that, protein, we should have include high biological value protein. Indian diet mostly they are having a dal, but the dal is not a good protein source. We have to combine the dal with the one amino acid lacking in the dal. That's why it's not a complete protein. We have to include with the rice in a proper combination, and portion size should be controlled. We have to control the portion size as well. And we have to exclude all the sugary beverages and focused on healthy drinks. Fluid should be there. Dehydration, we have to avoid the dehydration as well. Include water at regular interval of time in our day-to-day life.
Right. Thank you for that, Dr. Deeba. Dr. Prasad, I'd just like to bring you in. A lot of people work out, especially the younger lot, but it's across age groups, which is a very good thing. Especially people going to gyms. What is your advice to them? Do they need to take something additional on top of a balanced diet that Dr. Deeba outlined, or should a regular diet just do?
See, a regular diet can do at people of my age, but when we are talking about the younger lot who are going there for workout to, get 6 packs, 8 packs, look, where the looks are important, the muscle build is very important. So in those patients, in those people, they would need to what we call as a preload. So before you go to your gym, you should have some carbohydrates, something very simple like a banana, because this carbohydrate can prevent the breakdown of protein, which otherwise would have happened. To make it sound simple is that if you don't take carbohydrate before, then whatever protein which is there in your body will get metabolized during the exercise. After the exercise is over, whatever protein loss you might have had, you need to take more protein, and that's where if you are not able to supplement it with your normal diet, obviously have roast chicken and grilled fish, egg whites, those are perfect. But if you can't manage with just that, then yes, the role of supplements come, whereby we are looking at whey or casein or any of these protein supplements. The supplements should not be excessive. After all, natural is always the best. So to take supplements or to go overboard can lead to their own complications. Deeba, any comments on that?
We have to maintain the skeletal muscle mass, and for that, post-dinner snack is also very important. And casein is the best to use post-dinner. Whey can be used as a rapid protein intake, and casein can be for the sustainable protein. We can use that.
But who should avoid such supplements like Dr. Prasad mentioned? Get it from natural sources, but if not, supplement. But is there any age category or people with health risks that should avoid extra supplementation?
Any supplement is not generalized according to the disease condition, patient age, and all. We have to divide, and according to the patient need also, we have to distribute the protein and micronutrient. According to that, we have to count that. And for every person, there is a specialized kind of need of nutrients, and we have to focus on that.
Right. Dr. Prasad, a lot of people I know, and we've all been guilty of it. Suddenly in first week of January, we'll get very inspired, put on our sneakers and start, getting into an exercise routine. But in Delhi, where we are based, the air is not very supportive or whatever. But other than that, there are health risks also of trying to do too much too soon. What is your advice to people as they start on this journey of both dieting and exercise?
See, now everything has become very specialized. So ideally, you join a gym where you have a trainer who has more knowledge than you and more knowledge than you try to gather on Google, and go by their advice. Anything excessive, anything sudden can be a problem. For example, each one of us after the age of 40 has plaques in their coronary arteries. And someone who goes on a sudden exercise, heart rate goes up very much, plaque can break, lead to sudden cardiac events, which we have seen quite a lot over the last few years, whereby people who everyone says, oh my God, he was absolutely fit, suddenly pata nahi kaise kya ho gaya, and patient died or the person died. Right. So one has to be definitely careful, and it has to be just like the diet. Diet has to be in moderation, so has the exercise to be in moderation.
Right. And a lot of people, and one hears these nuskas online about drinking warm water with lemon squeezed in, not just sipping more water to keep yourself hydrated, but also as a weight loss strategy. Plus, we find a lot of other supplements which are available, some with very high caffeine, or some drinks which have very high caffeine. Are they really effective? And if not, what are the dangers of these drinks?
See, the benefits of these are far too less compared to the potential risks. So it's not worth it. It's not worth trying to lose 1 kg or something and drink coffee all day from morning to night, have your heart rate increased, or any of these other medications. Because a lot of times in these magic pills, you don't know what it contains. So it can, actually harm you. Go natural.
Right. Dr. Deeba, I'd like to draw your attention to the other side of the problem, which is, weight loss or losing weight is primarily, I think, for a large number of people, the goal. But a lot of us also need effective strategies to gain weight because they may be underweight. And those people are so lucky, and I envy them. But what is an effective strategy for weight gain?
Same weight gain also required a proper balanced diet, and it should be not only macronutrient, it should be rich with the micronutrient as well. and it should be patient customized as per the patient need. And we have to, like, if the patient is 6 feet tall, then we have to calculate his protein intake and the sources of the protein intake. Beside that, the thing which is feasible for him, we have to plan the things according to his it's easily approachable, and according to the availability and everything we have to take in mind. And weight gain also required the same thing, but everything should be in the balanced form.
Right, right. Dr. Prasad, I'd like to ask you a different set of questions now, which is on dieting and the types of diets people are on. Again, on the internet, you throw out information. There are these magical diets that are out there. Popular personalities are pushing some diets, whether it's keto or it's intermittent fasting, etc., etc. Broadly, what is your sense of these diets and how effective are they?
See, many times you have these diets which are actually foreign diets. They will have items in them which one would never have heard. You need to Google, then you need to, rush to some exotic Jorbag shop or somewhere to actually find those things. So, and it's, as I said in the beginning, whatever you do, it has to be sustainable. So there's no point losing 5 kg weight by hook or crook in a month and then not being able to maintain it. It's much better to do, say, 1 kg plan for losing 1 kg a month, and if you can lose 12 kgs till the next new year, that is a much effective strategy, and that is something which can last. So longevity of these diets is what is a problem. Secondly, many of these diets are not conducive to the Indian palate. So initially you'll find it tasty, but after some time, you start feeling nauseated even by the smell of that fancy salad, which initially you thought was quite good. And Mediterranean diet is something which is slightly close to our Indian system, because it just talks about taking fruits and nuts and vegetables. So I personally feel that we follow God, follow nature. If in a particular season a particular fruit is there in your region, in your state, in your country, then it must be there for some purpose and it will be useful to you. And things like when to have an apple, there are seasons where you have fruits which have more water, like melon. So go by seasonal fruits and vegetables and have those. So that they will definitely complete your nutritional requirements. And simple things like, for example, if I give you roti, a plain roti, you will not be able to eat more than X number. But if I give you puri or paratha, you can eat endless without even realizing how many you have had. Plain rice, after some time you will stop. Fried rice, again you can keep eating. So if you stick to basics, the body will self-regulate. If you go to very highly refined food, what we talk about, whether it is a Western pizza or Indian jalebi and samosa, then that's where the things go complicated. It can be had once in a while. Evening food is an issue which I find responsible for a lot of weight issues in the Indian condition, whereby people don't eat anything in the day and they land up home, oh, I'm very tired, have a lot of snacks in the evening. Moment they reach home, have a heavy meal, parathas and everything else at night and go to sleep. So that is very anti-metabolism. It should be the reverse. You should have your big meal in breakfast, second big meal lunch, and after sunset I would recommend have nothing but fruit and salad, the way nature made it for the cave people. So when humans were living in the cave, after sunset they could not cook food or eat food, and those are the genes which we've got, and it will take millions of years to change those genes. So please follow what appears simple and nature friendly, and you will not go wrong.
Right. Excellent advice, as always. My follow-up question to that is, what are the health pitfalls of these extreme diets? We've seen these diets of protein only or no fat or only fat. In your clinic, do you come across people who have followed these diets and have had health implications?
Yeah, most of the people are coming to us by following ketogenic diet and ketogenic diet, intermittent fasting, and all these. But they are in those patients. I'm finding that they are having rich one nutrient in very large amount, but other nutrients are missing it, and skin sagging and low glycemic control is very weird, and beside that they are micronutrient deficiency, like complaining of the hair fall and pale skin and everything. Anemia, osteoporosis is quite common in those patients because they are not taking the food in a balanced form. They are taking one nutrient in a very high amount and other nutrients are missing, or sometimes they are eating at one time, and rest of the just because of that they are ruining their insulin resistant, and such kind of issues are there in those patients. That's why the balanced diet which we can follow for a long and sustainable goal.
Right, right. And Dr. Prasad, as we are drawing this conversation to a close, let's also be mindful of people who may have mobility issues or who may not be able to lose weight despite their best efforts, and you should not feel crestfallen at that. It happens to many of us. What are some of the other strategies that are available for a person who would turn up at your clinic and say, "Doc, I've tried everything," or "Sir, what more can I do? Can you help as a surgeon or as a professional?" So typically, how would you deal with such a request?
Right. So ideally, as we talk, is prevention. Should be prevention for obesity. Nobody should need to come to hospital for treatment of obesity. We can treat other diseases now, but unfortunately, what happens? We have what is known as a set point. So, for example, if my weight is 60, I lose 10 kgs, become 50 due to some illness. Nature is going to make me feel hungry. So as soon as I recover, I'll feel very hungry and I'll bring my weight back to 60. Let's look at it the other way around. Starting from Dashera to New Year's, my weight goes up from 60 to 70. So I would expect that, after it has reached 70, I should feel anorexic, I should not feel like eating, etc. But unfortunately, it doesn't happen. In fact, you feel like eating more because nature is not so kind to us. So the set point, what has happened is your set point has gone from 60 to 70. Now, when I start exercising and dieting at 70 and weight comes down to 65, body is going to say, "Oh, no, set point is 70. It will make you feel hungry and try and take you back to 70. It might actually take you to 71 or 72 because of what is we call as a famine gene, whereby, God has given us these genes in the past that you store some food in your body because of the famine genes, because you never know akal kab aane wala hai. But nowadays there is no famine, there is no akal. So it keeps going up and up. Same thing is there for women, because women have to get pregnant, they have to have lactation. So the genes are there to try and conserve the energy, try and store, because we might need it, all that energy for pregnancy and for lactation. Maybe she may not be able to get food during pregnancy and lactation, and the baby will suffer. So for that, these things are there. So once the set point goes too much up, then these diet and other issues will not work. So once your BMI crosses 30, 35, 40, once it goes higher and higher, it will not be possible to control. And there we have what are known as interventional treatment, which is known as bariatric or metabolic surgery. And the reason why it's called metabolic surgery is it changes the metabolism. So it's going to reset your set point back from 670 to 60 by changing the balance of the chemicals. So the chemicals which were bad for you, which had gone up, will come down, and the chemicals which are good for you, those levels will go up. And this will be on a permanent basis from chemicals from your body. So that is one. Other option is the same chemicals. We also have medicines. So we can give drugs for the same chemicals, but drugs, because they are exogenous, they are not of your own body, they will have to be taken for a very, very long period, which would be expensive, because all these medicines are expensive, and as we all know, all medicines have their side effects. So we recommend that in people where the weight gain has become irreversible and it has become a threat to life, it's causing diabetes, it's harming your joints and harming your sleep, then you should opt for bariatric surgery, which has been proven to have the best results on a long-term basis for a sustainable weight loss. We have been doing this surgery since 2004, so almost 20 years experience we've had. We've also been having more technology since 2012. We are doing robotic bariatric surgery, and generally the results are very good. It's a very safe surgery if done at a center which has all the facilities, well-trained staff, and a good team. So it has excellent results and people are quite satisfied. But I would like to underline, this is the last resort, not the first resort. You want to become a model, you don't come and get a bariatric surgery done for that purpose. You get it done because it's required for medical reasons.
Right. So it's a medical intervention and not for cosmetic reasons. My last question, Dr. Prasad, is basically if you're starting out now in the winter, at least in the north of India, it's very cold. And a lot of people have, I won't call it misconceptions, but certain conceptions about metabolism slowing or hastening as the seasons change. A, is there any truth to it? And B, if not, should we be exercising all year round and expecting good results if we manage both diet and exercise?
We should definitely be exercising all the year around. And cold actually makes you feel like eating. It's not that you are actually hungry, but it gives you that feeling. That whole mahal is there where, let's have some pakoda, let's have some chai and things like that. So it's more of a feeling because of the atmosphere. Somebody in the tundra in Russia sitting there where, the mahal is not there, is not going to feel more hungry just because it's cold.
Right. So on that very optimistic note and excellent advice, I'd like to thank Dr. Prasad and Dr. Deeba for joining us for this Facebook live session. Thank you so much for joining us today.